Well, good morning, good afternoon, and good evening, everyone. Welcome. Welcome to this meeting of the Global Coalition of Academies of Medicine and Sciences on Climate and Health. I'm Victor Zhao, the president of the U.S. National Academy of Medicine, and it's my great pleasure to welcome all of you. We have a special meeting today as part of COP30 for academies together. I want to start thanking you by thanking you to make time to join us today around the globe for a discussion about how we, academies of medicine and our networks, may work together in this critical area of climate and health implementation and action. We're joined today by some of the world's leading experts in climate and health, by presidents and leaders of national academies who are members of a newly formed global coalition, and by over 300 participants from across the globe. So we'll hear more about the importance of climate health later on from our speakers, but it's such an opportunity to work together to launch, during the time of launch of the Belém Health Action Plan, and the fact that aligns with the climate work of academies around the world. So I want to start by giving some background about what brought us together today. Early this summer, I had the privilege of attending a COP30 working meeting in Brasilia, to review and discuss the Belém Health Action Plan. I was truly inspired by the plan, the goals of the plan, and felt that the academies of medicine, because of the nature of our mission, can be helpful in their implementation. Consequently, I came up with the idea of bringing together all the academies of medicine across the globe to form this global coalition to support the Belém Action Plan and work collectively to facilitate the implementation. So, of course, I consulted my good friend and colleague, Edith Buscala, the president of Brazil Academy of Medicine, who immediately shared my enthusiasm. So upon contacting many of you, the presence of the Academy of Medicine, it was clear there was a ton of interest in the concept of the coalition and working together on this critical topic. As you know, since then, we convened many of you in one or two meetings and proceeded with advancing this idea. So we today, the newly formed Global Coalition of Academies of Medicine and Health and Climate, unanimously express enthusiasm to endorse the Belém Health Action Plan, and two, to work together in climate and health in the long term. And that enthusiasm was warranted because we know from firsthand that academies have such a powerful voice and powerful role promoting science and evidence-based decision-making, developing and informing policy at many levels, advancing research, innovation, and co-production of knowledge. And we do all this in an independent, neutral, scientific, and nonpartisan manner. Next slide. So that brings us to today. You can see the agenda. We'll spend time talking about how we advance our collective work. We certainly, during our first plenary, will start off with keynotes from one of the world's leading authorities to hear about the importance of climate health and why it is something we should all be investing in. Then we hear from Brazil's COP30 leader and the architect of Belém Plan, specific about the plan and its priorities. So finally, you hear from my colleague Elliot, who will announce the joint statement to endorse the adoption and implementation of the Belém Plan at COP30. And by the way, I got good news, great news. Lancet has agreed to publish our statement during COP30. They just accepted something I submitted along with your academies listed on there. In the second part of the meeting, you hear from leadership academies about what their work is, what they're doing in their work. And of course, this is going to be very important. And of course, we'll have a section where there's interaction from each one of you. So lastly, we'll spend some time talking about what's next for this coalition. We think about COP31 and beyond. So next slide, please. So my final slide would simply say that, Academies of Medicine are well suited to support the Belém Action Plan and to move forward with action about health and climate because we're the trusted voice of medicine and science. Second, we will map our activities as we do today to three action lines of the plan and how we can help implement it. We will collaborate with governments, society, civil society, and communities to implement the agenda. Of course, together we commit to measurable actions during and after COP30, track progress, and promote health equity and justice in climate health responses. So thank you very much. It's my great pleasure to welcome you. And let me turn over to my friend and my colleague and my partner, Professor Elliot Buscala.
Thank you, Victor. I'm very pleased to say good morning, good afternoon, and good evening to all of you. I'm here in Brazil, and I have the possibility to go tomorrow to Belém, and I will be seated in the blue zone together with our Minister of Health, the President of the Pan American Health Organization, the Minister of Health of Australia, and the Minister of Health of Uruguay. And I'm extremely proud to give the word of the Academies of Medicine, which agreed to sign the beginning of our work, because I see this as a beginning, because Brazil is having a terrible problem with climate changes like inundations, heat, and tornadoes, and everything which we have never seen before with this intensity. So I look at this as the starting point and hoping to have more and more voices together from academies, which are, as Victor said, trusted voices for the people that we should do whatever we can to fight these possibilities of destroying the earth where we live in. So it's my great pleasure to go to Belém and to see and to be a voice from our coalition, and hoping that this will continue for many, many years to come. Thank you. And again, I'm very happy to be part of this coalition. Thank you.
Thank you, Elliot. Actually, the next slide shows our statement. If you can pull that up. Yes. So Elliot will read the statement publicly at Belém on the plenary session she's at. And many
Yes.
of you have already signed on to this, right? And I think the next slide shows how many signatures we are already obtaining and more to be confirmed. So thank you.
I will show this in Belém as well.
Great.
Both.
And the Lancet paper will be coming out during the time of COP30. I don't know what date yet. We're working with them at this point. I'll share this with you. Chris will send a copy of that draft to all of you. Thank you.
Thank
So
you.
thank you, Elliot. So let me therefore say what a pleasure it is to welcome the special guest and plenary speaker, Dr. Maria Neira, my good friend. She has just announced a well-deserved retirement from the WHO and remarkable career in that organization. Maria served as the director of Department of Environment, Climate Change and Health at WHO, and she led successfully the Alliance for Action on Climate Change and Health, ATTACH, which brought together over 95 countries, over 80 partners to advance the implementation of climate change and health commitments and priorities. Under her leadership, ATTACH developed a strategic plan, new governance and operating structure, and made really significant progress. We're really grateful, Maria, for your leadership. Prior to that, she served as the Undersecretary of Health and President of the Spanish Food Safety Agency. Dr. Neira is a medical doctor by training, Master of Public Health, and University Diploma in Health, Nutrition, Epidemic Preparedness, and Crisis Management. Maria, thank you so much for joining us. It's great to see you again, and please take the floor.
Thank you. Thank you so much. And thank you, of course, for this very warm and nice and friendly presentation, dear Dr. Victor Tassau, our president of the National Academy of Medicine and a very good friend. So Victor, thank you so much. And thanks for inviting me. And thank you all for being here and for demonstrating this incredible commitment to this incredible task. You know, we say in Spain, and I'm sure that you say it everywhere, that big tasks require big people and big commitments and big, when you have a big mission in front of you, you have to be at the level of the ambition required by the magnificence of the problem. And I'm afraid this is what, if we create this network together, we will try to promote more ambition and a different speed than the one we are having until now in response to one of the biggest public health crises that we are confronting. I love it when you mention about the enthusiasm. It's a word that I think is a big driving force for all of us. But it's not only enthusiasm. Of course, when scientists, when academies of medicine are enthusiastic about something, they need to have big science behind. And this is the case. So that's why my first statement to all of you will be the no excuses and no regrets. This is exactly what we are trying to promote when we talk about the fact that the climate crisis is a public health crisis. We started to repeat that slogan, if I can call it like that, several years ago. And I'm afraid we still need to repeat it and repeat it and repeat it until everybody understands that this climate crisis is not just a question of solving the problem of emissions and negotiating on the percentage of emissions we are going to reduce, on taking more time to organize COPs until we are all, you know, I don't know which age. And it's about urgency, and it's about our health. It's about human health. And I think the moment people will understand that, I think that day we will advance at a different speed, and we will advance with a different level of ambition. So, dear friends, no pressure, but I want to put a big word on the table: responsibility. So we have enthusiasm, we have science, but we have as well a huge responsibility in front of us. Why? Because we have a big diagnosis already done. And as doctors, we always rely on the diagnosis. And I'm afraid this diagnosis leaves very small space to discussion or to disagreement. I'm afraid our patient is requiring a very quick response, the most advanced one, and we have all the tools for that. So big responsibility for the academies of medicine. We need your very, very credible voices, and we need to have statements. I'm very happy about COP in Belém. I was supposed to moderate that panel that it was described before by Elliot, but I couldn't be there. But it's a fantastic opportunity to hear the voice of the academies of medicine because of the credibility that goes attached to that. So first thing, we have resolutions on climate change and health. You know that. We have several resolutions at the World Health Assembly based on science, based on studies done by people like you, with huge knowledge, with many years of experience, the best experts around the world. So no excuses, big science behind demonstrating that climate change is affecting our health. I don't need to describe you how, because I think you are the best ones to know it and to have participated to finally have this very strong diagnosis. We know how our population is affected, and we know as well that we have the political tools and the interventions that are ready to help us moving the world on responding to this. We have those tools, we have the resolutions, we have the plan of action adopted at the last World Health Assembly. We have a network of doctors, health professionals, NGOs, civil society, more and more recognizing that something that until now people didn't really visualize, the fact that our lungs are affected because we have a major problem of air pollution, which is affecting all of us and killing more than 7 million people every single year, associated with the bad quality of the air we breathe. So if it's not anything else, I think we have already a huge mission here in terms of explaining everyone that the causes of climate change and the causes of air pollution overlap on a 75%. And that's why this transition to renewable, clean, phasing out fossil fuels, transition in a way, which is the politically correct word that all the politicians are using now, transitioning away from fossil fuels is the best way to protect our lands. And therefore, it's our business. It's not just the business of those working on energy sources, those governments deciding on the priorities on economic terms. It is our business because we are talking about the health of our people. So that's why, for me, it's important that we remind the negotiators that are in Belém at the moment, many negotiators, many countries, accompanied by 50,000 people attending Belém, but the negotiators are just the number of countries who wanted to contribute to this negotiation, which is going, in my opinion, very, very slowly, at least not at the speed that the public health problem will require. So we need to remind those negotiators that any decision they take is not just about the percentage of emissions that they need to reduce. Whatever decision they are taking, they are negotiating with our health as well, because they will decide, according to their decision, how many cases of obstructive chronic pulmonary diseases we are going to have, how many cases of asthma, how many cases of lung diseases, or cancer, lung cancer, how many association with our health, that is air pollution is affecting all of our body, how many cases we are going to have of diseases, and how much our health system is going to pay for it. And here is another very strong argument that we need to use a little bit more. A few weeks ago, I had the opportunity to discuss a big ceremony called the Princess of Asturias Awards in Spain, which is very well known in Spain, in Latin America. And Mario Draghi was one of the winners. So Mario Draghi is a very famous economist and all of that. So we have the opportunity to discuss with him. And I told him that as the health community, we are quite concerned to see that the economists, the very high-level economists, when they do studies about how climate change is affecting us from an economic point of view, they never include externalities related to climate change and health. And I asked him about the health externalities, and he was quite, a little bit challenged, because he recognized that it's true that they never incorporate the health externalities, means how much our health system, not only our health as a patient, but our health system is already paying to treat those chronic diseases that are associated to climate change causes and air pollution causes. So our society is already paying for. So when people use the excuse that we don't have money, we need to use that argument of the externalities and how much the health system is already paying. But dear friends, the Belém Plan of Action is a kind of consolidation of all of those messages that we need to pass around. How much we need to adapt, and you will hear it from Agnes Soares, a very good friend as well, and a former colleague of WHO as well, and how much we need to adapt, how much our health system needs to become resilient, and how much to attach this big platform where countries on a very enthusiastic way. Good news, Victor, we reached already the number 100 in the last day. So yes, it's fantastic. We have many hospitals around the world, many people, many associations who wants to be part of a touch to contribute to this decarbonization of our health system. And this is generating a very positive wave and a very much enthusiastic community, very much motivated because they see as health professionals how much they can, on a very tangible way, contribute to this climate change mitigation and adaptation. So our community is motivated, but they need your voices, they need your enthusiasm, they need your messages, very relevant, constant. And this takes me to another point. We need to adapt, we need to be resilient, we need to make sure that we have the best investment on making sure that our health system is climate sensitive for the climate sensitive diseases, which is again a non-regrets interventions, because we are proposing to invest on better epidemiological surveillance, better training for our health workforce, better efficient in our healthcare facilities. We are proposing to have vector control initiatives. So actually is all common sense and nothing else that secondary prevention, as we call it in medicine. But we need to do primary prevention as well, which is mitigation. And for that, our voices can be extremely powerful on telling people that not only they can mitigate the causes of climate change, by doing so, they are generating incredible health benefits coming from better and more sustainable food systems. You will save a lot of an incredible number of deaths coming from malnutrition and lack of healthy diets. You will have enormous health benefits for tackling the causes of air pollution, reducing air pollution, that the benefits will be enormous, and you will have enormous benefits as well from a healthy urban planning, which is what we are trying to do with the cities. Last week or last days, I was in Rio de Janeiro with the World Mayors Summit, and it's incredible how they are moving, how cities are taking a leading role as well on implementing interventions at the city level on a very intersectorial way, promoting sustainable public transport systems, promoting more efficiency, energy efficiency in their buildings, many interventions to reduce air pollution, to create green spaces, to absorb and reduce the problems associated with the heat waves that everybody's suffering at the moment. So I think we need to work very much, and this is a role as well that I'm putting on the table for the national academies, work with mayors. They need us. They need us because some of the measures they are putting in place at the beginning might not be particularly popular for the people. You know, at the beginning, when you restrict traffic, people will complain. But when you explain, and we help them to explain the health benefits that can be obtained from those interventions, when Sadiq Khan in London was able to say, well, my friends at the World Health Organization are telling me that ULEZ, the ultra-low emission zones, is reducing hospital admissions, and I have the proof to that. And for that, we need experts, we need academies, we need all people working on the medicine as well, the health professionals, to provide those arguments for mayors to be more courageous, to go for more, to create this positive action that they are generating at the city level, and I'm very proud of. Of course, we need to put them pressure and for them to do much, much more, but they can be very strong supporters of a climate action in the name of health. If we help them to quantify the health benefits, to use it to communicate. And this is another point I wanted to touch with you, the communication. Dear friends, don't take it for granted. In the past, when a society like a National Academy of Medicine or WHO or any expert around the world or ministries of health will talk, everybody will accept it and no questioning. Today, we cannot take anything for granted. And the communication, as you know, is one of the big challenges we are confronting these days. And that's why I'm inviting you to be very strategic on the communication. And I think we have a very good strategy, but look at your tactics to communicate. So we need to be strategic, but we probably need to change and adjust our tactics of communication. We need to listen carefully to all of those populists that we have outside, all of those who are excellent on communication, because we need to accept that they say what people want to hear, and they say things that will not cost much or will be easy, and they are confrontational. So we need to listen to them and then maybe adjust our tactics to go and not to be populist, of course, I'm not promoting that, but certainly aligning our messages on a more, on a way that will reach and touch differently our citizens. Maybe we need to use the very deep science to communicate among peers, of course, and debate among peers, because obviously science is about debating, it's about controversy. But when we talk to our citizens, maybe we need to listen a little bit more to those populists and taking them by surprise, which is a technique I am promoting now, which is the TBS, taking them by surprise, and using a language that they are not prepared for it, and that will respond to the needs of our citizens. So we need to popularize us. For the citizens, of course, when we talk about science, we need to keep with our levels and high standards, of course. But we need to train ourselves to respond to those needs of communication that our community is desperate and looking for. Colleagues, I think I talked a lot, and as you know, it's my passion, and I could keep on that, but I think I passed already some of the key messages that I wanted to share with you. Again, I started with the responsibility and enthusiasm, and I will finish with that. Responsibility, because I think only public health can take now the driving force and accelerate all of this, which is putting at risk our population and generating a public health crisis. So thank you so much. The opportunity is huge, and I trust all of you that you will not miss it. We will not miss it altogether. So good luck in Belém. Good luck for all of us, because our health is discussed there very much more than at the ministers of health around the world. Whatever they will decide will have an impact on our health. Thank you so much for this opportunity, and a great pleasure to be with you. Thank you so much.
Wonderful. Thank you.
Yes, Maria, thank you so much. You know, your talk is live streamed, and there's over 300 viewers at this point. So very great message. So your message is incredible health benefits and incredible economic benefits if we take the no regrets action. Certainly for us, you know, the National Academy of Medicines, we will implement interventions, as you said. We'll do that through our medical school, university, hospitals, and of course, as you said, work with the mayors, the government, and we're about science. And if you look at the Belém plan, surveillance, that's what we do in advancing science and surveillance. Capacity building, as you said, educating our workforce, innovation and production. That's what we're about. Finally, you talk about communication, the importance of trust, that we need to change our messaging approach, align it with the public citizens, and take them by surprise. Thank you. So outstanding message. So thank you so much. Great to see you again. Let me turn over to Elliot, who introduced Agnes Suarez, who's another great leader. Thank you.
Thank you, Dr. Maria Neira. I'm extremely happy. Before I introduce Agnes, I just would like to comment that I'm extremely happy about this because I think this crusade about climate and health is a great opportunity for our academies to get out of the ivory tower. I think we need to get closer to the people. And I
Right.
think what you mentioned is very, very important, that we should be able to talk in a language that our public can understand, because we are trusted. And I think that in every society, physicians are trusted. And I think this is very important. So I am saying that I'm extremely pleased to introduce Dr. Agnes Soares Silva, which works at the Ministry of Health and is the director of the Department of Environmental Health Surveillance and Worker Health. And I'm very happy because I know about your role in organizing the Belém meeting, which is a very, I think it's an extremely difficult task. And from what I have heard so far, it's a success. So congratulations, and very much looking forward to what you say, because I will be there tomorrow. Thank you.
Well, thank you for the introduction, and I would like to greet Dr. Victor Dizal. I could call him a friend now because we have worked so many times together in this agenda, and I've seen his commitment to it. I recall, I always say that you know, in times of hard work, you know the ones who stay on your side. When we had a preliminary consultation on this Belém Health Action Plan in March, I don't know if you knew about that, but he was online like for 2 days, the whole day, and make comments and interventions in all aspects we introduced it in the plan. So I feel very close to this process. So, and I also like to greet Eliette and both everyone from this very important alliance and this coalition that we see growing, and the importance is, I'm quite sure this movement will have in terms of mobilizing forces to help us move forward faster the way we think it is, like recognizing the urgency to action. And as I'm here at in Belém, and you cannot feel it, but it's very hot and very humid, and a lot of people, enthusiastic people, and long lines. But it's an amazing feeling of a big party of people committed to this agenda. And I think yesterday we had some good news. I know maybe you don't follow that, but we were worried. Brazil was worried because not too many countries had presented their national determined contribution. But I was happy to hear that 111 countries submitted for the appreciation of the conveners here, and I think this is a huge success, and many of them, and we will analyze that later on, will include health in their commitments. I think this is a wonderful news, and it shows that no matter what, no matter the geopolitical problems we're facing in the whole world, we are seeing that multilateralism, climate multilateralism, is not only survive, it's growing strong. So I think this is the situation we should see now. And I believe, although we have a long way to go, we know there are people interested in things, and I am really committed to face the problem of climate as the urgency as it is for us from the health sector. And I also thank you, Maria Neira, also good friend, and I would say Camera, someone who has been working together, but she is the one who put this agenda inside climate discussions at a global level. So great leader, and we had the opportunity to see her talk during our meeting here in July in Brazil, pre-COP meeting to discuss health. And I think that's wonderful that we can get all this together. And I agree, Dr. Tizal, and also with Marianeira and Eliette, we are mobilizing forces from the health sector. So we are in practical means responding to this call to this big multidão. This is getting together to solve the complex problems. And I think you are doing this in a very special way, and I thank you to making this happen, particularly Dr. Victor and Dr. Eliette, and I know the efforts you have in putting in organizing this, not only the session, but organizing all the academies to respond in a organized and very practical ways to this crisis. And in this, I would like to start my presentation by showing where we are in this agenda. Just what's the next slide? The COP presidency has chosen 6 thematic axes, and we, the health sector, is on the 5th, fostering human and social development. But in fact, health is related to everything else. But in this, and for the first time, we are high in the agenda. Next slide. So there are 30 key objectives, and as you see, if you read all of them, we can see the link with health. But there is one that is objective 16, that is promoting resilient health systems. So this is something nobody else can do. Only the health sector can do that. Of course, we need the others because there is a limit. There are limits to what you can do to increase resilience, to work on adaptation. But this is the way we can enter and sit on the table and talk to others, and that's what I would say Belém Health Action Plan is talking about. The next is. So we are building the Belém Health Action Plan on a long history of other initiatives, and Dr. Victor spoke about that. But we must think that even for the Paris Agreement to include global goal and adaptation and the way it contributes in the health, where health enters, there's adaptation agenda. It was there at the beginning. There are many WHO resolutions, but the last one was the Global Action Plan on Climate Change and Health that was approved last World Health Assembly. And the previous activities at COP. So since COP26, there is this action that is started with the alliance, and then on COP27 with ICANN, Climate Action Nutrition, and COP28, we had the great declaration that helped us, and also the finance principles for financing climate change and health solutions. And last COP29 in Baku, we had the presidency contributing coalition for climate and health to bring us Health Day at all COP, and that's what we're doing now. So it's rooted in solid experience, previous experiences, and also this sense of urgency, the sense of need of action that is this call for the for COP30. And next slide. So what we're doing is thinking on how to accelerate solutions. So the ones that are there and exist sometimes in a small scale that can be scaled up, and the ones that we need to do and we have to prepare the way to building it, but there are already people committed to do it and the possibility to scale up. So that's what we included in the plan. So it's a robust action agenda. It's not one more declaration where we are looking to implementing concrete solutions. So next slide, please. The whole plan is built in two cross-cutting principles: enhancing health, equity, and climate justice, and leadership and governance with social participation. So this should be seen throughout the plan. So every concrete action, we should go through these principles. And I would say climate justice is a concept that we use, that has been used before in COP language, and we are doing is translating what it means for us from the health sector when implementing action from the health sector. And then three lines that will coordinate, I would say, that will guide the action: surveillance and monitoring, and evidence-based policy strategy and capacity building, and innovation, production, and digital health as a way of putting forward, of moving fast towards adaptation of health systems. And next, please. So the main objective, it's clear, it's the health sector's adaptation and resilience to climate change, and working to promote resilience of communities as well. But this is a plan that takes into account the diversity of needs and the national context. So we talk about the importance of a cross-sector collaboration to accelerate mitigation effort, but we talk from this health perspective. So we bring the health argument, we bring the health data, and we work together to increase our power of negotiating with other sectors. Next, please. So in fact, what we are doing is one solution, that's the Belém Health Action Plan, and we think on 15 outputs. And for each one of them, we have actionables. So in total, we have 60 actionables that need to be worked or promoted or financed at a global level to make sure that we will be of course, agreement with the plan, and the implementation of the plan must follow the needs of each participant country. But also, like the endorsement or the support from other parties that are non-state actors, such as the academies, will help find solutions and implement the solutions at all levels and to the plan. So as you see, we describe what it is in all of them, but for each line, for action line 1, there are 3 important outputs. Action line 2, there are 7, and action line 5 main outputs. So next one. So going a little bit more in details, we want to improve climate-informed health surveillance. And this means we know that at some point all systems have health surveillance. How do we make them smarter, that we can improve our capacity not only to foresee the high impact events that are the disasters, but also to foresee what is happening with warming. Like I was yesterday in a discussion about Chagas disease, and the discussion was what will happen with Chagas, because there is an opportunity, and Brazil was working towards elimination of Chagas disease. And what climate change makes it harder to do that? And then this is the part the plan has to address. And so for each one of them, identify a priority of a priority list of climate-related risks and diseases, because they differ much from the place where you are, and improve health risk management and climate events and emergencies. And there are many examples on how we can do that in a way that saves us and also protect public health. So next, please. Here, their own evidence-based policy strategy and capacity building, I would draw attention to the need to prepare our workforce. So it's like music to my ears to listen that you are committed to improve, the education, the training of health professionals, and then doctors. Medical doctors have an essential role to play because they are trusted, and if they know what they're talking about, I'm quite sure we'll have a different respect for what needs to be done, and also we will increase participation of the communities, of the whole population, the whole society, in addressing the problems that need to be addressed by the whole society, not only by the health sector, but also integrating mental health and thinking on how we promote adaptation policies to support populations in situations of vulnerability. So we need to address how we measure that, how we know we are progressing on that. These are all questions that we have. So it's basically looking at what science teaches us and what we need to do to implement, thinking on the most vulnerable and the most and the population that are the worst situation. Because if we protect them, we are sure we are protecting everyone. Scientists. So next, please. So on action line 3, and that's the part that everyone working in any program knows how difficult it is and how we need to work there. These are already challenges we face in the health sector, like organizing health systems, and anyone working in a hospital or a clinic or primary health care knows the importance of it. But what we need to address is not only the challenges that we already had, but the ones that we're facing now, that are worse now because of climate change. So thinking on resilient infrastructures and services, and the innovative adaptation policies that we need to address everything from vaccination. So how do we keep coverage when we lose contact because of either floodings or drought or any major climate event, but also in terms of reaching out for communities that were never had full access or universal health care access that we praise so much in our sector. So, and thinking of this just transition for the adaptation, but also how do we work on health supply chain to strengthen this way that will serve the most vulnerable, but also that we decrease the impact. So we also promote mitigation in a way that will also the contribution of the health sector to mitigation will be important. But this means having not only new ways of doing it, and this involves the whole pharmaceutical industries, but how do we buy, how we distribute, where do we keep them, and how do we make them more resilient? and thinking of stockpiles, equitable access to essential health products in any situation. These are the headlines, but you have many linked to this, and here at COP we are having discussions in many bilateral or conversations, but mainly in the side events or events organized in the adaptation agenda and the action agenda on every aspect of what is related to strengthening resilience, thinking of supply chains and stockpiles, health policies, specific health policies. So next, please. So to do this, we are presenting two supporting documents to the plan. One is synthesizing evidence on climate and health public policies, and the other is a synthesis report on social participation in climate and health. And this is based not only in the experience of review, but also from the experiences in different countries, and in a way, because we think there is no way we can do it alone. So how would we increase the pressure to do things, but also the solutions that we need to have in every corner of the world? And this means we cannot do it without social participation. And there is a history of increasing value that this is having. The WHA document approved last year also promoted social participation in building the health system. So we are just saying we cannot do it without increasing involvement of the social society as a whole to have this work done. So next one, please. What will present the next slide at COP? Please, I will skip this one and we'll go to the next one because I think this is more on the details of the plan. Next. So we have the Health Day at COP30, and this, I would say, it's the first time we have in the UNFCCC space. It's a plenary. It's a huge room. So it shows the commitment to the agenda. It's still not, as Maria Neira said, part of the formal commitments that can be done on health. And I would say some of it appears in other aspects of the discussion of the agenda, but still we can see how how important health has become and central in the discussion of climate change. So we have a ministerial dialogue or high-level meeting. It's not only ministries of health, we will have ministries of environment and other high-level representatives from countries. And we will have a discussion with the Continuity Coalition and a high-level roundtable and announcements on means of implementation, because without discussing financing, it's also discussing only good intentions. And we've heard yesterday also that the multilateral banks are committed to change the way they are financing climate change, and they promoted different ways of doing this. But during Health Day, they will have to speak about what it means for the health sector. So I think we have a very busy agenda, and we hope everyone coming to Belém should be there. And I'm happy to hear that you sent your commitment on Health Day, and that the world, you know, that the Academies of Medicine are well engaged and willing to contribute to this plan. So next, and I think I finished this talk, and we are open to discuss more if needed, but we hope this is not the end. This is the beginning. And I always like to remind everyone, Brazilian COP presidency starts now during COP30. So we have the whole next year to implement, and we are counting on you to help us accelerate the implementation of the Belém Health Plan and to mobilize. We know we can mobilize when we bring the health sector to sit at the table. So thank you very much for the opportunity, and thank you for your huge support to the plan.
Thank you, Agnes. It was very nice hearing you, because I think that this is, as you say, very, very well, said very well, is the beginning, and we need to continue and continue and continue. And I think this is very, very good that you are planning to have all people together, and I think we should also be able to make simple addresses that people can understand what we are dealing with and could join us, because that will represent a force for us. And it's very important to always stress that this is the beginning and it needs to be continued, because otherwise it will not be leading us anywhere. Thank you very much for being here. Thank you again, Agnes.
If I may, Agnes, thank you so much for your leadership. I know that you're the architect behind all this work and is now seeing the fruit of your labor. So as I said earlier, you may not have heard it, Lancet is going to publish our statement and our paper during COP30. So I'll send you a copy of that and an early draft. But Elliot will be there to announce our statement of support. Thank you so much, Agnes.
I'm sorry, but I have to leave to another meeting that's happening.
Of course.
In the inside here. But thank you very much, and good luck to all of us. And I think it's happening, so I'm really happy to be here and be part of history. So it's a collective work that you also helped to build this up. So thank you.
Thank you again. See you in Belém.
Wonderful. Thank you so much, Agnes. And thank you to both our speakers. Wanted to say a major thank you to Maria as well for joining us. And before I begin, I want to introduce myself. My name is Chris Hanley. I serve as the director of our Grand Challenge on Climate Change and Human Health here at the National Academy of Medicine in the US. And I am very delighted for what is to come for the rest of our session today. But again, wanted to thank our two speakers and to thank our two hosts for setting this all up and putting together so we can have this amazing session. So before I begin our introductions into this session, I just want to, first of all, pass along that good news. We are on time, which means that the Q&A session that we're planning to host at the end of our time today is currently on schedule. For those of you who are watching on the live stream, below your screen, you should see a program called Slido that you are able to input your questions for our speakers at any time, and we'll get to them all at the end. So from here, I'm going to turn it over to our first speaker, who is Dr. Louise Bauer, who serves as the president for the Australian Academy of Health and Medical Sciences. Dr. Bauer, over to you.
Thank you very much, Chris. And hello, everybody. In fact, good morning, good afternoon, and good evening. And I welcome you from tomorrow, because I'm speaking to you from the land of the Eora people, the traditional custodians of what is now Sydney in Australia. Aboriginal and Torres Strait Islander peoples were my nation's first scientists, innovators, and healers. And we all have much to learn from their long, long tradition, over 60,000 years of custodianship of land. Now, in the next slide, I'll tell you briefly about the Australian Academy of Health and Medical Sciences. We're one of 5 learned academies in Australia, recognised by the Australian government. We were established as an independent, trusted advisor to government on health and medical science We're an interdisciplinary body of over 550 fellows, and we convene experts to address pressing health challenges and deliver programs that nurture future leaders. In the next slide, our strategy includes advancing research and innovation in Australia to improve everyone's health. Our vision is better health for Australia and the world, driven by the best health and medical science, and our values are shown there: evidence-based, impartial, trusted, inclusive and sustainable. And I'm sure all who are listening will agree with that and take on board those values as well. Now, in the next slide, I'll just highlight the brief issues I'm going to just speak about in a little bit more detail. So extreme heat events, and you can see some of the startling pictures that we can see of what we call bushfires, you may call wildfires, air quality and respiratory health, rising sea levels and flooding, mental health and well-being, and vulnerable populations. And these are major issues in my country for the health and well-being of our people and implications for the health sector. In the next slide, I'll just start to go through each of these. So we're very concerned about extreme heat events. Australian government modelling suggests an increase in heat-related mortality of over 400% for Sydney, which is the biggest city it's on the east coast, and Darwin, which is the most northern city, which is nearer to the equator, if we have a 3 degrees Celsius scenario compared to current conditions. And that is clearly unsustainable. And we're not alone as a country for this. In the next slide, we highlight the issue of air quality and respiratory health, already highlighted. So exposure to bushfire smoke, for example, can be from many, many, many kilometres away from the fire, can cause respiratory complications, lead to oxidative stress and lung inflammation, and increase mortality and hospital admissions, all of which have been documented in my country. In the next slide, I just highlight that this country also, which is an enormous island with most of the population living in the coast, is really affected by rising sea levels and flooding. So by 2050, it's estimated that 1.5 million people across Australia will be living in coastal flood risk areas. We've had altered rainfall patterns and flooding that contaminates water supplies and increases risks of vector-borne diseases. And flooding also disrupts health infrastructure and responder capacity, especially in rural and remote areas. Not uncommon in other countries who are listening to this. So in the next slide, we can also think about the mental health and social well-being that's impacted. So in 2009, we had very dreadful Victorian Black Saturday bushfires, and the follow-up from that has shown increased post-traumatic stress disorder, depression, alcohol misuse in affected communities persisting years after the event. And if we look towards flood events, then the 2017 northern New South Wales floods, that's on the east coast, it's the state in which I live, people at socioeconomic disadvantage were much more likely to be displaced, resulting in worse mental health outcomes. And our Aboriginal and Torres Strait Islander people fell disproportionately into this group. Okay, and in the next slide, just to make everyone feel happy and excited about the world, just highlighting the challenges we're dealing with. Our health system is also greatly impacted by this, with greater morbidity and mortality in needing to care in this situation, increasing heat-related illnesses, exacerbations of chronic health conditions, including cardiac disease, respiratory disease, and more, a high risk of communicable diseases, rising mental ill health, increasing transport costs and reduced access to medicines, exacerbation of health inequities, increasing biosecurity risks, and a reduction ultimately in productivity and economic impact These are profound arguments for addressing these issues. In the next slide, I just highlight that our Academy has developed a statement on climate change and health, and we believe there are priority actions for the health and medical research sector in particular. So this includes promoting recognition among decision makers across sectors within their institutions and to the public that climate change is a major and urgent health issue with implications for health equity. And that picks up on what has been said already. We feel that delivering health and medical research that further advances knowledge of the direct and indirect impacts of climate change is important, and this will enable monitoring and management of these impacts. We also highlight the need to support cross-sector, interdisciplinary and ecological investigations that will bring about health co-benefits and prevent disease impacts resulting from the causes of climate change. And importantly, in my country, but in many, many other countries, collaboration with First Nations communities and experts is needed to learn from Indigenous knowledge practices that, in Australia's case, can inform our path forward and ensure that First Nations voices are implemented. But this is not just for my country, because First Nations people have much to teach elsewhere. This is a vital issue for any nation, both Australia and the world as a whole. The Academy sees that we must be aware of and prepare for and act urgently on the health impacts of climate change. The climate crisis is a public health crisis. So thank you and obrigada.
Thank you so much, Dr. Bauer. Next up, we have joining us from the Philippines, Dr. Jamie Montoya. And Dr. Montoya, unfortunately, the Philippines was hit earlier by a Category 4 cyclone. So first of all, our thoughts are with you, Dr. Montoya, but we are lucky enough that he has joined us. But they are worried a little bit about their technical issues. So they were kind enough to send over a pre-recorded video this morning. So we're going to go ahead and play that, but Dr. Montoya will also be joining us for the Q&A session. They just didn't want any interruptions in their technology to stop his presentation. So we'll load that up right now, and we'll go from there.
Good day, distinguished delegates, policymakers, and climate champions. My name is Jaime Montoya, President of the National Academy of Science and Technology, Philippines. And today, I want to talk about an undeniable truth. The climate crisis is fundamentally a health crisis. It's not just about rising temperatures or melting ice caps. It's about the air we breathe, the water we drink, the food we eat, and the very health systems designed to protect us. Southeast Asia, a region I'll focus on today, stands as a stark and urgent case study. Its tropical geography and high vulnerability make it a frontline in the fight against climate change. It shows the world the compounding health threats of climate disaster. The core message of this workshop report and my message today is clear. We must transition from reactive response to proactive resilience, and we must place health equity at the absolute center of this transformation. Let's ground this in reality. Southeast Asia is not just vulnerable, it is a hotspot of climate health vulnerability. The region is experiencing an alarming increase in the intensity and frequency of climate-induced disasters, stronger typhoons, more severe floods, suffocating heat waves, and relentless sea level rise, eroding coastlines and livelihoods. Consider this. In 2022 alone, the Asia-Pacific region accounted for a shocking 70% of global climate-related displacements. These are not just statistics. These are millions of lives uprooted, futures shattered. These disasters bring with them a cascade of compounding health threats, from acute injuries and loss of life to widespread food insecurity, the proliferation of waterborne diseases, vector-borne diseases, and a profound toll on mental health. The crisis is immediate, it's multifaceted, and is rapidly worsening. Our report, Adapting to Climate Change, Safeguarding Health from Disasters in Southeast Asia, was developed under the leadership of the UK Academy of Medical Sciences in collaboration with the National Academy of Science and Technology, Philippines. The workshop was held on 22 to 23 January 2025 in Manila, Philippines. We have three main objectives. First, to assess how climate-related disasters impact health outcomes. Second, to identify gaps in evidence, data, and governance. And third, to propose concrete policy and research pathways for resilience. In short, we sought to transform scientific knowledge into practical action. Our first critical theme is that health, equity, and justice must underpin all actions to overcome the threats posed by climate change. Climate change is not a neutral threat. It is an accelerant of inequity. The report identified major issues, particularly the disproportionate impacts on women. The data is stark. When climate-related disasters like flooding occur, women are 14 times more likely to die than men. This is not a biological difference. It's a structural one. It's caused by limited access to information, resources, and often due to social norms. They are less likely to be taught life-saving skills like swimming. Furthermore, climate change increases the risk of gender-based violence. Increased drought and water contamination force women in rural communities to travel to isolated areas and cover longer distances to secure resources. This journey puts them at a dramatically increased risk of violence. We must acknowledge that climate change is negatively impacting those segments of the population that are already vulnerable, despite having contributed very little to global emissions. Therefore, our action item is clear. Political will and leadership must ensure every intervention implemented to adapt to climate change is transparent, equitable, and genuinely inclusive of community perspectives. Our second theme is crucial, avoiding the maladaptation trap. Participants in this workshop emphasized that this risk is often discounted in the climate change agenda. Maladaptation refers to interventions that aim to help countries adapt, but which unintentionally increase their vulnerability to climate risks. We must not be short-sighted. A chilling example comes from Bangladesh, where the implementation of certain flooding measures while protecting some areas had severe unintended consequences downstream. These measures reduced soil nutrients from the water and effectively erased vital floodplains that were a notable source of food and income, particularly for women. The progress toward resilience was undermined, leaving those populations more susceptible than before. The report warns that maladaptive consequences are often not immediately apparent. Therefore, the long-term impacts, both intended and unintended, must underpin how we address climate change, or our progress towards safeguarding health will be fatally undermined. The third theme stresses communication for action and trust. The report identifies this is a critical tool for exploring innovative ways to engage key stakeholders, moving beyond just informing them. The goal is mutual communication to facilitate effective engagement between and among everyone, communities, policymakers, the media, and scientists. Every stakeholder has a responsibility here. For instance, governments must actively work with researchers and communities to determine the best ways to communicate disaster risks, ensuring the message is understood and acted upon. But how do we communicate effectively? The workshop participants offer key insights. We must tailor communication to local practices and harness existing channels. In a digitally connected region like Southeast Asia, this means utilizing platforms like instant messaging systems such as WhatsApp to quickly and reliably disseminate critical disaster warnings directly to local communities. Furthermore, we cannot guess what works. We need to formulate strategies informed by behavioral scientists. This helps us map the different information needs of communities facing climate disasters, ensuring our communication doesn't just raise awareness, but actually changes behavior. Communication is the currency of adaptation, but its value is undermined by its ability to engage and build trust. Our fourth theme is clear. Communities should co-create interventions. It is absolutely critical and crucial to shift away from top-down policies and embrace co-creation, a form of collaboration where we work with local communities to develop solutions that are effective and tailored to their needs. To succeed, we must centrally reinforce the immense value of indigenous knowledge in scientific research. Local communities possess generations of wisdom about their environment that often surpasses modern data sets. A compelling case study from the workshop in Thailand powerfully illustrates this point. Researchers were comparing 3 different tree maps used for flood mapping, one produced by the government, one official map, and one produced by the local community. It was definitely determined that the community-produced map was the most accurate. This is not just anecdotal. This is evidence that community data and expertise must be at the center of our climate resilience efforts. To formalize this, we must develop a value-based framework that places an emphasis on trust, transparency, and collaboration to bridge the current underrepresentation of community data in the field. Solutions are strongest when they are owned by the people they serve. Our 5th key theme addresses the critical governance issue, improving transdisciplinary coordination and developing a regional science policy practice continuum. The complexity of climate-related health concerns means we must enhance coordination across agencies and disciplines, both within the healthcare sector and outside of it. Climate change is not just a health issue, but also an environmental, agricultural, and urban planning issue. Strengthening public-private partnerships in research is one practical way to achieve this cross-sectoral collaboration. Beyond coordination, we face a major challenge, translating scientific evidence into effective policy. Southeast Asia would greatly benefit from developing a regional science policy practice continuum. This means establishing a formalized framework to ensure that scientific evidence is built directly into the process by which interventions are formulated and enacted nationally. National science academies have a key role to play here. By formalizing this approach, we not only support an evidence-based approach to climate action, but we actively support the crucial integration of health into all climate interventions. Our 6th core theme is to strengthen the evidence base and maximize the use of technologies. The discussions revealed that while we understand the broad threats, we have critical evidence gaps. Specifically, we lack robust data on the social determinants of health, issues like mental health, justice and equity, and how they specifically intersect with climate change. This data is essential for developing effective National Adaptation Plans, or NAPs, though we are seeing positive steps from countries like Thailand, Vietnam, and the Philippines. To close this gap, we must actively maximize the use of technologies, software, and data portals that can efficiently process and integrate complex information. This will facilitate better linkages between science and policy. To overcome the systemic gaps, the workshop participants proposed a tangible solution: the creation of a regional climate change and health center and a dedicated database for research. This is how we centralize knowledge, share best practices, and transform raw data into life-saving, evidence-based policy for the entire region. Our 7th key theme is to facilitate knowledge sharing at all levels. We cannot afford to work in silos or duplicate efforts. We must be smarter by harmonizing and sharing knowledge to prevent avoidable overlaps and spread up vital research agendas. The report emphasizes leveraging existing networks. Groups like the WHO's Alliance for Action on Climate Change and Health, the ASEAN Climate Resilience Network, and grassroots initiatives like the Connecting Climate Minds Hub already draw on collective power to promote climate health policy. We must actively tap into this. This effort must also be institutional. While health systems have found success embedding early warning, we must look beyond. We need to consider policies in areas like education, specifically in medical schools, to provide future generations with awareness around the climate health interplay at an earlier stage. The ultimate goal is the development of a regional mechanism for multisectoral collaboration that vastly improves knowledge sharing, turning isolated successes into regional standards. Our final crucial mandate is to improve data accessibility and linkage. Even with integrated policy and strong coordination, progress stalls if the data remains locked away or disconnected. Participants emphasized making data sharing and accessibility more straightforward. We need to effectively connect information on climate-related events, for instance, linking temperature data with specific heat stress data, and connecting this information to local areas. The hurdles are both financial and technical. There are often costs required to access non-governmental data, and perhaps an even greater barrier is the skills gap. We lack sufficient capacity in the analytical skills needed to link climate change to health outcomes. To overcome this, 2 actions are paramount. First, More training opportunities must be established to build the necessary analytical skills across the region. Second, we must develop a platform using existing structures to improve data access and create those vital regional links. By breaking down these data barriers, we can empower local experts to create the evidence-based interventions the region desperately needs. The workshop also showcased 5 critical case studies that illuminate how climate change is impacting health and how we can effectively adapt in Southeast Asia. Our first example from northern Thailand serves as a powerful cautionary tale against maladaptation. A policy aimed at conservation unintentionally caused a mental health crisis within the Korean community because it failed to account for the cultural and spiritual values of their farming land. The core lesson is that climate policies must deeply consider their social and cultural impacts. Second, from Indonesia, we see the success of women-led initiatives. Women are highly vulnerable during climate disasters due to inequities, but when they're fully involved in preparedness, responses become more effective and resources like water are better conserved. Third, addressing flood risk in Selangor, Malaysia, the CDAR program exemplifies a community-centered approach. With flooding projected to increase significantly, this initiative successfully equips community leaders with science-based knowledge to build resilience from the bottom up. Fourth, the data on infectious diseases in the Philippines is alarming. We see clear climate sensitivity. Drought predicts malaria risk, while rising temperatures intensify dengue. The response must be technological, leveraging tools like AI for better surveillance and predictive prevention strategies. Finally, the case of the Amang Rodriguez Memorial Medical Center in the Philippines highlights the vulnerability of our health infrastructure. After severe flooding disrupted critical areas, the hospital developed an infrastructure resilience plan, moving vital equipment and repurposing flood-prone areas. This shows that marks our healthcare facilities resilient is essential to essential public health during a disaster. These 5 case studies underscore the need for solutions that are equitable, locally informed, and backed by strong technology-enabled science. In conclusion, the workshop firmly established that acting on climate change is critical to safeguarding public health in Southeast Asia, particularly for vulnerable groups. While there is existing momentum, such as the national adaptation plans, several challenges continue to hinder effective action. Specifically, we identified 4 persistent barriers: inadequate communication, poor interdisciplinary collaboration, barriers to data accessibility, and governance issues. To overcome this, participants agreed on 5 critical next steps. We must meaningfully engage with communities to co-create solutions. Communities are needed to embed an evidence-based approach across the region to ensure science-informed policy and reduces the risk of maladaptation. We must fully integrate climate change and health initiatives, shifting our focus to prevention rather than just treatment. And finally, networks and research networks facilitate collaborative research across all disciplines to ensure our policies are multifaceted and integrated. Implementing these actions to provide policymakers with the necessary knowledge to make health a priority in all climate interventions. Thank you, and have a good day to all of us.
Very good.
I very much agree. Very, very well done. Very much appreciated to you, Jamie. And I think you are on, so we look forward to seeing you in person for the Q&A section, but that was wonderful. So from here, we're going to continue hearing during this session from the Academies of Medicine about the work that they are doing in climate health, specifically how it ties into the Belém Health Action Plan. And up next, I'm very happy to introduce Dr. Friday Okonufua, who serves as the Vice President of the Nigerian Academy of Sciences. Dr. Friday, over to you.
Thank you very much. Good afternoon from the Benin City. My name is Friday Okonufua. I'm the Vice President of the Nigerian Academy of Science and also the Secretary General of the African Academy of Science. Next slide, please. Next slide. As you know, Nigeria is Africa's most populous country and the 6th in the world, and is one of the countries in the world that is very susceptible to the health effects of climate change for multiple reasons. First, geographical location between the Atlantic Ocean and the Sahara Desert, sub-Saharan Africa, and part of it is in the Sahel region of Africa. Very limited infrastructure and very severe socioeconomic factors, including high level of poverty, existing disease burden, most of which arise from our ecology and so on. Then climate variability, food insecurity, and population growth, which is highest, one of the highest, not only in Africa, but in the world. So for this, we are highly susceptible. I think indeed, Nigeria is one of the countries in Africa that is very highly susceptible to climate change and its health effects. Next slide, please. Well, what our approach to the health consequences at the National Academy of Science, Nigerian Academy of Science, is being to collaborate with the federal government of Nigeria, because we did believe that we are change agents, we have the evidence, and so we'll try to use those evidence to collaborate with the government to decrease the consequence of climate change in various developmental areas. In February this year, we organized a national multi-sectoral conference on climate change that brought together academics, fellows of the academy, policymakers, and government agencies to find ways to discuss, to ratify the changes, effects of climate change in various sectors in this country. And there are about 7 sub-themes of our conference. With respect to health, the conference resolved to pursue the line of innovation and production, because we already have a lot of evidence on ground as to the health consequences of climate change. So we believe that pursuing the line of innovation and production will be helpful in addressing the related health challenges. We believe that this approach, if well designed and implemented in Nigeria in collaboration with other parts of the world, will have implications for the rest of Africa, because Nigeria is the biggest, and the rest of Africa will look to how we address it, even though other African countries also have similar problems. Next slide, please. So to date, arising from the conference of January 2025, Nigerian Academy of Science has been working with the Nigerian government. I want to say that the Nigerian government is fully represented at the Belém conference, and indeed the president of our academy is currently traveling, or in fact must have arrived in Brazil for this conference. So the Nigerian Academy of Science is working with multi-stakeholders, Nigerian government, policymakers, academics, and industry partners to develop solutions for sustainable future in terms of resilience, with high impact implications for health in Nigeria and the rest of Africa. We intend to hit this collaboration within the NAM-led multi-academics initiative on this approach, open to galvanize international thinkers, stakeholders, and development partners to support our planned activities so that it will be a model for the rest of Africa. Next slide, please. So we have a 4-point approach to this. And I know that these 4 points are very exhaustive. They're not exhaustive, but at least we'll start from this approach. Because I think that addressing health challenges of climate change is still very native, very naive in Nigeria. So we want to start from the very beginning to see what we can do in terms of health system strengthening, developing innovation and technology, collaboration and partnerships, research, including monitoring and evaluation. Next slide, please. With respect to health system strengthening, we tend and we are planning and working government to enhance health system preparedness and their response to climate-related disasters, which often happen now and again. We have things like flood, food insecurity, banditry. In fact, the high rate of banditry in Nigeria, where people are kidnapped, is because of pressure for arable lands from the northern part, which is arid, to the southern part, which is more forested. So when we hear that there's a fight between farmers and herders in Nigeria, most of which is due to climate change. Herders trying to move from the more arid north to the south and looking for grass, and that again causes conflict with our farmers. The second approach is to improve surveillance and develop early warning systems for climate-sensitive diseases, and our researchers are involved in it. I currently work with TED Fund, which is one of the funding agencies in Nigeria, and part of their focus is to try to see how researchers can develop early warning systems for climate-resistant diseases. Thirdly, to increase access to healthcare services, particularly those at risk and at times of climate change problems, including vulnerable population. We believe that diseases like Lassa fever, which are native to Nigeria, Ebola, are possibly due to climate change effects. And so we need to concentrate on this and try to make sure that these diseases are completely eliminated from our country. Next slide. You can go there. So the next is to leverage technology and innovation. In particular, we are working in government to develop and deploy climate-sensitive health technology, as I said earlier on, such as early warning systems and disease surveillance tools, such as including genomics. We are utilizing digital health platforms and mobile technologies to enhance healthcare access and delivery, and some of which I have developed my team here in Nigeria, particularly at times of climate change. We use this technology during COVID-19, and it was very useful. So we're expanding it to its use at times of climate change. And then furthermore, to support research and development of climate-resilient health solutions, which are being discussed a lot of researchers in the country. Next slide. So collaboration and partnerships is very important to us because as a developing country, we can't work alone. We need to foster partnerships with governments, academia, industry, civil society, and to support knowledge sharing, capacity building initiatives, wherever they occur. Encourage community engagement, very important, because most of what happens and happened at communities is due to poor knowledge of communities about climate change and its implications and what they can do to be resilient. So we really want to encourage community participation and engagement in climate mitigation and adaptation efforts. Next slide, please. Monitoring and evaluation and research. Part of what we do is that we know the evidence is not very strong in our context, not only in Nigeria, but in many African countries. So we hope to be able to strongly develop indicators through research that will help us track progress, outcomes, and impact in climate change, related health changes. And then conduct regular assessments, regular research, and evaluations of climate change and health interventions, health solutions, and particularly use data to inform policy and practice in relation to climate change. Next slide. Next slide, please. So in conclusion, because I was expected to speak for 8 minutes, it's a call to action. The collective action is very essential for addressing health changes and health impacts all over the world. And we are very grateful. The Nigerian Academy of Science is extremely grateful. President Abubakar is very grateful to you for inviting us to join this initiative. Given that the developing world, especially the African region, is most vulnerable, despite the fact that the causes of climate change are not necessarily generated from Africa, yet African countries are most vulnerable. Therefore, specific actions need to be undertaken to rectify this problem in the region. So on that note, I thank you very much, ladies and gentlemen, for listening. Thank you.
Thank you so much, Dr. Ogbonifua. That was a wonderful way to end your presentation. I really appreciated how you drawn the alignment with the priorities of the Belém Health Action Plan. So wonderful stuff. And it is my pleasure now to introduce Dr. Victor Zhao, who sits here in the United States as the president of the National Academy of Medicine. Dr. Zhao, over to you.
Thank you, Chris. And I've certainly enjoyed all the presentations and greatly encouraged by the efforts that the other academies are doing. I thought what I'll do is begin to introduce ourselves to all of you, and then talk a little bit about our work in terms of climate and health and how it aligns with, in fact, the Belém Action Plan. Can I have next slide, please? So we were founded in 1863 as National Academy of Sciences by Abraham Lincoln in Congress as an independent, science-based organization to advise the nation on issues of science and related issues. And of course, over the years, we evolved into three academies: Academy of Science, Academy of Medicine, and Academy of Engineering. We coexist under one roof and co-convene and govern the national academies. We are made of distinguished members. In fact, Friday Okonofwa was just inducted last month, and we have some 2,000 members who are elected, and of which over 80 or 90 are Nobel laureates. So very distinguished members. Our main work is to advise, convene, and catalyze influence policy. As you can see here, we're convening meetings and roundtables and forums and action collaborative. But we also generate deep dive reports, which in many ways shape the policy and agenda in medicine and health. For example, our 1999 report, There Is Human, is well known for the first ever report about medical errors and started the whole initiative of patient safety and quality globally. A report on confronting AIDS led to the formation of the U.S. policy on PEPFAR, which, as you know, has been the major source of treatment for HIV globally, although it's under some, shall we say, challenge these days. Our 1988 report on mapping the human genome launches the whole idea of the Human Genome Project. Our 2016 report on human genome editing first articulates the importance of ethics and societal implications of genome editing. And of course, we are active in infectious disease and also in climate, such as the report on global health risk framework for Ebola. And right now, we're the secretary for G20, high-level panel for financing, being the same in 2021, as you can see in the right-hand side report. We have just actually released a report tomorrow globally in our recommendation G20 for pandemic financing. So our reports are very authoritative and important in influencing both national and global actions. Next slide. Now we have conducted our work according to a strategic plan. Here you can see the 5 goals of strategic plan: science, action, transformation, opportunity, and readiness. And of course, what's relevant to today's discussion is part of science and technology innovation, but also lead and inspire action, as well as transforming the health system and having opportunity to all and ensure that we are ready to shape the future of health and medicine. Next slide. So about 7 years ago, our academies came together to say, what is a grand challenge facing the world and of course our nation? And climate became that selectively that grand challenge. It's now been a multi-year global initiative to look at human health and climate and transform systems that you hear about that contribute to and impacted by climate change. So our strategic initiatives are listed here. Communication, as Maria said, which is so important. Second, develop a roadmap to transform systems for climate and health. Third is to catalyze the health sector ourselves to reduce its climate footprint, ensure resilience. Fourth is accelerate research innovation. And finally, to look at health disparities, to address climate-related health disparities. Next slide. So we have approached our work with 5 pillars, as shown here. These are significant initiatives in each area, which I won't have time to go into, addresses communities at the risk and marginalized community, our messaging and education effort, both nationally and globally, looking at how to bring together all the sectors, including agriculture, energy, transportation, construction, and others, to put health and climate, health in the middle of all these policy interventions, to look at our own health sector, to look at how to achieve climate resilience and sustainability, and fund advanced research innovation. And we have products now in every one of these areas, formed by separate different initiatives, but together integrated under the grand challenge. This is a very large initiative, which is multi-year, multi-million dollars of including lots of activities with public-private partnership, and of course, led in this case by Chris Henley, who's overseeing this session. Next slide. I want to spend more time mapping our work towards the Belém Action Plan and the three priorities. As you heard, one is to advance surveillance and monitoring system. Second is to look at policy strategies, capacity building. And third, to foster innovation, production, and digital health. And of course, cross-cutting is equity and climate justice, governance, and social participation. We're actively working in all these three areas in many different ways and in great depth. Next slide. First, in surveillance, our research agenda in looking at building resilience in the face of climate foundational work is to actually support health surveillance. So we have actually put forward ideas of how to improve surveillance work on climate by providing evidence-based tools and tools. But also we're actively participating on the Global Preparedness Monitoring Board co-convened by WHO, World Bank, which are looking at pandemic preparedness, but that in many ways prepare us to look at surveillance in a much broader way, including climate. Importantly, I'm co-chairing the Science Technology Expert Group in the IPPS, International Pandemic Preparedness Secretariat, the 100-day mission, which we spend time monitoring diagnostic therapeutic vaccines and looking at monitoring framework. And finally, we're now working on the pandemic risk assessment, which is very similar to here, looking at upstream surveillance, looking at risk and other drivers for climate change, as well as for health in a One Health fashion. So we're actively working on surveillance, and our work will fit very nicely with the Belém Action Plan. Next slide. In the second area, in evidence-based policy and capacity building, we have recently done a fast-track study to look at effects of human-caused greenhouse gas emissions, US and elsewhere. This report really is evidence-based to highlight the importance of mitigating greenhouse gas emission. But also in our climate collaborative, as you saw in one of our pillars, we have four working groups, public-private together with healthcare supply chain, with companies such as Cardinal, McKesson, and many others, which are global supply chain, with healthcare delivery with health systems, with health professional education and policy, and finance metric. We have over 100 participants, 85 organizations that look at ways to improve and reduce carbon footprint. And importantly, in this case, supply chain is an important area, which I'll discuss later. Also, we have an education capacity building, which fits under this second Belém Action Plan, which will work with Cecilia Sorensen at Columbia University on the Global Consortium for Climate and Health Education, regionally learning collaboratives US and globally, involving literally hundreds of thousands of educators and educated. And then finally, we have a communication pillar by which we have created a climate and health information gateway for, in fact, capacity building. Finally, we have, as I mentioned, this pillar called Climate Community Network, which engages with, in fact, marginalized population, US, but also now extending globally, look at co-designing solutions and informing policy and practice and communities and nationally. Next slide. On the last of the action plan for Belém, which is innovation and production. Here we're clearly doing research innovation, and we are also working towards many other collaborators, such as Healthcare Without Harm and others, to strengthen resilient infrastructure, service, and technology. But importantly, as I mentioned, we have a working group on supply chain. This supply chain has done a lot of work, first in creating a climate action survey to standardize and ease the burden for healthcare suppliers to report climate and sustainability data. Also, we have created a climate journey map to help suppliers globally to look at how to begin, look at best practices, toolkits, innovation, adaptation, and scaling. And also, we have now in performing a consensus study looking at transforming systems. So these belong to the innovation production sector. But importantly, I co-chair the Regional Vaccine Manufacturing Collaborative with World Economic Forum and CEPI, which have been launched to look at how to increase regional manufacturing production, along with what in fact is the purpose of a G20 Brazil Local Production Initiative, as well as this Belém Action Plan to increase local production. So as you can see, many of the work are well aligned with the three actions of Belém Action Plan. And we will continue to do this work to support the Belém Action Plan. Next slide. So I want to say how excited I am to work with all of you, because this global coalition will begin our journey together. As I already heard from Australia, from Philippines, from Nigeria, you are already doing so much work. Together, we can go far. So if we want to go far, I'm ready to work with you. And therefore, we should launch this, as we have already done, this coalition, to start saying, how can we all work together to address climate and health? How do you support the Belém Action Plan? And how do we, in fact, start looking at impacting health and climate in the future? Thank you very much.
Thank you so much, Doctor. Thank you so much, Dr. Zhao. Up next, Elliot, I wanted to see if you would like to have a chance to share some of your work where you sit as the president of the Brazilian National Academy of Medicine. If you'd like some time, it's yours now to share.
No, I just would like to say a few words, saying that we have been founded by the Emperor Peter I in 1829, with the mission of counseling the government with about everything which affects the Brazilian population in terms of health. And so for this reason, we have assumed several possibilities, and we have talked to the government in the past, but then afterwards we started to have a Minister of Health, and then the role of the Academy became a little less than before. And now we are trying to work together again with the Minister of Health to discuss the things, mainly the diseases which are affecting the Brazilian population. In terms of climate, we have been aware about it acutely after the flooding in several of our cities. And then we started to join forces with the Brazilian Academy of Sciences, and we are proposing several measures for the government in line, which I have heard from Victor Zhao, the president of the Academy of Nigeria, Philippines, and so on. And I think that now the Brazilian Academy of Medicine is very much aware of the role that we should play in terms of health, which started in a very shy way already during the epidemic of the COVID-19. And in terms of the Academy, I should tell you that we have only 100 members, 40 in clinics, 40 in surgery, and 20 in basic sciences. And normally the basic sciences and the Brazilian Academy of Sciences work together very, very much. So I'm planning now to, after coming back from Belém, to make a summary to all of you about what I have been able to hear and what we have been able to impress people. And to return to our academy to show a lot more about what we have been doing and hoping that we continue with us. I fully agree that we should go together if we would like to go far. And this is a beginning of a very serious attack to protect our health, because in a way our planet is not doing very well, and this is from what we depend on, regardless if we are rich or poor. So I look forward to Belém, and I hope to share with you my impressions and what we have been able to achieve. Thank you.
Thanks so much, Dr. Pascal. It's so amazing to think about what you're going to accomplish over the next couple of days at the COP30 meeting. And so very much looking forward to hearing from you on that summary that you just mentioned that you're going to produce. We'll be waiting and in anticipation. So again, thank you so much. And from here, I'm going to introduce Dr. Sandra Cortez, who's joining us from the Academy of Chile de Medicina. Dr. Cortez, over to you.
I'm sorry, could you hear me?
Yes, we can hear you.
Okay, thank you so much. Thank you for this opportunity to share our work made in Chile. I'm Sandra Cortez, and I am the president of Scientific Committee on Climate Change. And I was invited by Dr. Manuel Oyarzún from the National Academy of Medicine to show and to share with you our experience working on the different activities that we made to promote scientific evidence on the public policies in my country. My goal is to comment with you how my small country articulates science and climate governance. I would like to show some evidence from my country and the works that we made from the National Academy of Medicine. For that, I would like to show you that in my country, we have a law specifically for climate change. And you can see at the national level, the main ministries working together in the Council of Ministry for Sustainability and Climate Change. But the lead of these governance efforts is the Ministry of Environment. And we work as scientific committee, as advisor for the Ministry of the Environment, together other actors, for example, the National Council for Sustainability and Climate Change. But we provide evidence and we provide the best information for the Ministry of the Environment, and they are the responsible of the governance about the climate strategy, especially from the NDC and sectorial mitigation and adaptation plans. In that case, we are the only advisory committee that only for the national level, but we are working together with other people from the regional or local levels to put on the agenda the scientific evidence. In that case, according to this law, we are part of the Scientific Committee on Climate Change. We are 11 researchers from different universities, different parts of the country. We try to have parity on gender, and especially we try to stimulate the interdisciplinary and transdisciplinary knowledge working together as scientific committee. I am the president. I was elected by my colleague because I put on the table that the main idea that we need to improve the health conditions and the social conditions for faces the challenges related to climate change. And for that ideas, my colleagues put me in this kind of situations. We start working together about 1.5 years ago, and during this year, thinking on the NDC and also thinking on the COP30, we promote scientific dialogues about climate actions, and our goal was to produce recommendations and try to strengthen the design and implementation of public policies, considering the different mechanisms. We working with several researchers sharing papers. We organize virtual workshops. We organize some meetings in Santiago, in the capital, and we work a lot with the blog from March. We start with this strong work with the Ministry of Foreign Affairs and Ministries of the Environment. And for us was amazing to foment these dialogues, because the academics are very motivated to be part in the take the decisions. And we work with more than 240 researchers, and we working, for example, developing scientific recommendations for the NDC, or we are working to prepare specific reports. Among them, the most important for us is the summary that we have to show in the COP30 in Belém about health and the most important threats in my country. For example, sharing the experience for Brazil, we also have extreme meteorological events, and we know that this represents an increase of the mortality by cardiorespiratory disease, because we have very high problems with air pollution. For example, the air quality for us is very important, especially because in the middle of the country we use wood burning for heating the houses. And also we have in other places of my country, especially in the central area, wildfires and drought. And we show that the water security, or in fact, the food security could be affected. We are evidence about the mental health problems, especially in younger people. We detect eco-anxiety and trauma related to wildfires and other extreme events. And also we are experiencing changes in the distribution of infectious disease, especially related to mosquitoes and other insects. And we are worried about that. And our proposal is especially working in two specific areas, especially the contamination plans regarding the air quality, and also try to improve the early warning system, especially for heats and diseases related to water, vector-borne, and food transmissions. And we have the instruments regarding the national plans with the NDC as an umbrella. In general, we set these priorities because we know that the health is a national problem in my country, and so we are working a lot to put the health emergency as part of the national climate actions, especially because we have now in the previous NDC the Chilean government put in the middle the social disparity, but we need to include with more force the health impacts in the populations. And also we know that we have evidence of the direct impacts, and especially because we face this challenge with previous public health problems related to chronic disease and the inequality and social inequality. And our recommendation is try to develop and robust policy frameworks, but improve and put more ambitions, especially because we need to define better indicators. We need to develop better early warning system, and we need to put on the agenda the intersectionality that we need for face the health problems. In general, we are working on these issues, strengthening sectoral governance, working especially put in the center children and workers and women. We need to discuss and try to obtain more funding and investment, because in general we don't have the resources put in these urgency issues, and obviously to work in promote health cover benefits. And in that issue, in this moment, we advance a lot, especially working on clean energy and sustainable transport. And we know that actions produce benefits on population health. And regarding the works made by the Academy of Medicine, especially Dr. Oyarzun, was part of the scientific dialogues. And for us, it's very important that the Academy of Medicine continuing with working with us as scientific committee, because they start working some years ago, try to put the attention on the change on health related to the climate change. And also they produce some reports to highlight the importance of climate justice. And they are very worried about air pollutions, because we don't have very good systems, especially regarding the wildfires. And we agree that the air pollution is the main environmental health problem in my country. And the Academia of Medicine in this moment are using this clean air prescription, the title of this job. You see Maria Neira is among the authors, for investing in healthy lands and healthy future, because if we consider the recommendation from the guidelines made by the WHO, all my country show problems with air pollution, especially particulate matter and some toxic gases. And closing this presentation, we think that the experience that we are made in Chile could be valuable for other countries and for other Latin American countries, because we try to develop participatory mechanisms. We try to develop structures and procedures for support the regional knowledge through networks. And also we are working a lot with the teacher from the basic school, middle schools, try to strengthen their work. And obviously we are trying to develop toolkits and prove different methods for improve the knowledge. And we are available to co-produce across regions and community the condition for face this challenge. And only these are some of pictures, and I would like to give my special thanks to Dr. Manuel Oyarzun and Fernando Cazorla for their support, and we try to do these presentations together for sharing our experience. Thank you so much.
Thank you so much, Dr. Cortez, for everything you shared with here and for sharing your experience. I know you are leaving immediately to get on a plane, I believe, and head to Belém. So
Yes.
sorry you can't miss, or sorry you cannot attend the Q&A session. So I want to take the time now to say thank you for joining us and presenting all the wonderful work that you have going on. And then last up, I'm going to invite to speak next, out of the Academy of Medical Sciences in the UK, Alex Hume, who serves as the Director of Policy. Alex, we'll turn it over to you to close us out for this section.
Thanks a lot, Chris. Hopefully you can hear me all okay. And lovely to see so many familiar faces. I should start by saying sending apologies from our President, Andrew Morris, and also our Vice President International, Tom Solomon, who wanted to be here today, but unfortunately with sort of short notice and competing sort of commitments and things, sadly couldn't join us. So I will try and do them justice and things. So today I am going to give a very broad overview of some of the Academy's work in the UK on climate and health, but actually really focus on a joint piece of work we did with the US National Academy of Medicine. So for those of you who don't know, the Academy of Medical Sciences in the UK is the independent expert voice of biomedical and health research in the UK, but we work both in the UK and internationally. So climate and health has been an emerging sort of priority for the Academy over the last 5 years or so. It sort of kick-started in 2021, where the Academy partnered with the Royal Society in the UK to deliver a large policy report on the near-term health benefits of decarbonisation in the UK, which was very much focused on UK policymakers and was ahead of the COP that took place in Scotland later that year. That has then led to further work, which was presented by Jaime earlier with the Philippines. We've also worked with the Academy of Sciences South Africa on some climate and health work, and it's sort of been central to a lot of our policy and work, particularly internationally, and in particular with the US National Academy of Medicine. So, as I said, today I'm presenting on a joint project that we ran in collaboration with NAM on the topic of environmentally sustainable health research and our subsequent report for People for Planet. The report is the work of 16 future research leaders who participated in the project, and it called for coordinated action by stakeholders across the UK and US health research sectors to improve the environmental sustainability of health research while safeguarding its quality and equity. The health of people and the planet are inseparable, in the health research system, which works to improve human health, must itself become a model for environmental stewardship. So this project took place between March 24 and September 25, and the two academies selected and convened a group of 16 future research leaders from their respective alumni networks to participate in a joint policy project. These researchers came from interdisciplinary backgrounds with representation from the academic, healthcare, private and public health policy sector based across the UK, US and also Hong Kong. So in terms of the background of this project, it acted on a joint commitment made in 2022 by our two academies to engage younger and new voices on the topic of climate and health, recognizing that they are the ones who are going to be most impacted by climate change. This sort of cohort are essential to the success of communication, mitigation and adaptation strategies. Both academies pledged to engage more deeply with these voices and leverage existing programs such as NAM's Emerging Leaders in Health and Medicine and connections with the UK Young Academy as well. So the project had three broad aims. One was networking, so establishing connections and networks between the US and UK participants within the climate and health sector. The second was around career development, providing experience of engaging with and influencing policy for those participating in the programme and developing skills related to this. And then the final one was around policy, so production of the policy reports on a topic related to climate and health. Next slide, please. So the report for People for Planet was the culmination of the policy project and was released in September this year, and it contained a set of recommendations to improve the sustainability in health research in the UK and US. You can read the whole report with the QR code just there. Please do go on and download it. We'd really welcome any sort of feedback on it. But I think the key messages to take away were that health research can and should be made more sustainable in order to contribute to global development and to environmental and sustainability goals, as well as to serve its fundamental purpose of improving health outcomes for all. Another key message was around the sustainable practices across all types of health research can contribute to meeting the needs of both the people and planet. And then the final one was around coordinated action that's needed by stakeholders at every level of the sector. Next slide, please. In the report, I won't go into too much detail here, but you can sort of see some of the environmental impact of health research that was sort of outlined in the report. And essentially, the existing evidence shows that laboratory, clinical, and computational research all have sizable carbon footprints. You can find more information about that in the report when you download it. Next slide. So I've sort of summarised some of the key messages at the top of the presentation, but just to focus down on the 6 key themes that the project focused on and was represented in the report. The first was on data metrics and information availability. So this included things like access to data, methodology and platforms to calculate emissions from research, and also standardized processes for doing so. Number two was funding, very much looking at the role of funders in facilitating and encouraging researchers and research organizations to make research more sustainable, and for the need for coordinated action on this. Thirdly, regulation, so the role of regulators in equitably building sustainability requirements in regulatory processes with research. Procurement and supply chain, so the role of supply chain and procurement and how this can be made more environmentally sustainable. And then the final one was around infrastructure, so physical and electronic infrastructure consuming considerable energy and generate significant quantities of waste, and how research teams require organizational support to construct and maintain infrastructure in a way that reduces energy demand and minimize waste without compromising operations for research quality. Next slide, please. So on here we have some examples of the challenges identified, so specifically the lack of standardization of information and methodologies, the need to build capacity of researchers and organizations, and also the time and cost and resources required to provide the necessary training, and then also the infrastructure and supply chain and the lack of consistent policies towards this. Overall, there were some important considerations that the two cohorts sort of felt strongly around, was the quality and also the equity, and recognizing these both throughout. Next slide, please. In terms of the call to action, there were 4 overall report findings that we sort of focused on. One was around adoption and refinement of shared metrics, tools and methodology, particularly for all research activities. The second was embedding sustainability requirements incrementally in funding, regulatory and publication processes. Thirdly, to invest in people and infrastructure, so prioritizing training and accreditation schemes and other sorts of things like green facilities that can be scaled up across different research settings. And then the final one was around the fostering of international collaboration and data sharing, so recognizing that climate change knows no borders, and that solutions developed in one context can benefit many others. I think that message has been heard loud and clear across the presentations today in terms of knowing no borders and sort of shared solutions. Next slide, please. So we've done some broad, we're starting some evaluation on this project where we will hear some evidence around the impact of it. But here are a summary of some of the reflections that we've had from the participants of the project, and really highlighting the importance of sort of cross-sector and international working, the need for evidence-based policy, and the value of learning how to translate research into policy, which I think all 3 of those sort of are front and centre of the Belém health plan. So I think hopefully those messages have been sort of heard loud and clear today. Final slide, please. And I am just the mouthpiece. These are the people who have been leading and working on this project. So we have our authors, the 2 cohorts from the US and UK. Special mention to our 2 co-chairs of the project, Dr. Yingo and Dr. Julian Wilson from the US and UK respectively. Our fellows and members leads, Paula Williamson and Melissa Simon. And then a big thank you as well to leadership from both academies, Victor and Tom for their sort of overall leadership, and then Chris and Annabelle Miller and Abigail Bloy from the UK Academy have been sort of front and centre of this project, and a big thank you to them.
Wonderful. Thank you so much, Director Hume. And having worked on that project with you, I would say you're much more than a mouthpiece. So appreciate all you had done to get us across the finish line on that project, because it turned out to be an amazing, amazing time. So that concludes the section where we will hear from our academies. Up next, I'm going to invite each of the speakers to come back up off of video. We are a little bit limited on time, so we have lots of questions coming in. So I went ahead and kind of summarized them around a common theme that I've heard, which was around communications. And I'll read it out loud now. And then for all of those who are joining us to answer the question, it is in the chat, so you can reference it at any time. So the question that we have from one of our audience members is, we have seen in recent elections, including notably in the United States, that climate and health policies we propose are not succeeding enough. Many times they are attacked and used to misinform the public. How can we stop this from happening in these countries and stop it from spreading into others? And I'll welcome all speakers to use the hand raise function or come up off mute if we think we can do that orderly. Maria?
Happy to start, if others allow me, very shortly. Challenging times for communicating, no doubt. And that's why we need to change our tactics, as I was referring before. One of the answers to that is to start to communicate in positive with things that are common sense. I have the opportunity years ago to discuss with a prime minister of a country that I know very well, and he was almost calling me a Greenpeace activist or a trees hugger or something like that, because you don't understand the economy and all of that. So instead of arguing, what I say is, will you disagree that we need to drink safe water? She says, of course not, Maria. And then I was taking him to one by one all the things that we are promoting through mitigation of climate change, clean air. What do you prefer, to breathe air that will irritate to your eyes and then your throat and everything, or cleaner? Of course, cleaner. And then I ended the conversation by laughing and saying, I'm afraid you are a bigger Greenpeace activist than me. And the guy was a little bit shocked. So I think we need to start to communicate on positive, on outcomes, on health language, and not trying to argue with things that are not at the same level. I mean, you cannot have an intellectual discussion, an academic and scientific discussion with somebody who is not using a scientific language. So it is very unbalanced. And the second point, and very quickly, is that I'm sure that if all of us now, they ask us, a very smart journalist will ask us, so if I understand correctly what you are saying in this webinar, more research is needed. So it means that you are in disagreement in the scientific community. You see, and then if we start to respond with a scientific knowledge and our systematic approach, we are dead. Because then we say, yes, of course, we need more research, we need more systematic reviews, we need this and that. But we need to start by saying, no, we don't need more research to start the urgent action. Yes, the scientific community will keep tracking and continuing and doing what is our responsibility to do, which is to provoke controversy among ourselves in order to advance with science. But we need to start by saying, no, if we want to advance, we have enough to go for action. Thank you.
Thanks so much, Dr. Mier. Dr. Zhao?
Well, I think Maria has emphasized how important communication is. I totally agree with you that we have to do things differently than the way we have been doing. So I think about the audiences. So Maria talked about policymakers. How do you talk to them? You can talk to journalists. How do you talk to them? And the public, what strikes the public? I think these are all different audiences, maybe using different tools. To begin with, I do think that while science is absolutely important, we must communicate in languages that our audiences really understand. So, for example, to the public, storytelling, narratives, personal experience, lived experience are so important that, in fact, we want to engage the public to help us communicate the issue of climate and health. For the health professions, we need to educate health professionals how to communicate and how they communicate with their patients. Maria already talked about policymakers. They're so important because they when you show them bar graphs and data, their mind will get foggy. Rather, they want to hear what it means to their constituents. And what does it mean for them to forward policy that can advance their agenda, and so forth. So I totally agree with Maria that we need to look at policy communications totally differently. We need to understand how social media is communicating and how do we use social media as well. So all that, of course, is based on science, and all that eventually will influence policy and outcome. Thank you, Chris. I'm sure that Jaime, you may have, I mean, you gave a really excellent presentation. You must have lots of thoughts in this area.
Yeah, thank you. Thank you very much. Well, not as much as you all people, but I can also contribute a few. I do agree with the importance of communication. And but I think the problem now is how to do it and who's your target audience. That's always a question for strategizing on communication. And if I may share, there's a school of thought here, at least in the Philippines, that scientists are not exactly the best communicators. They usually are very technical. They talk of jargon. Now the thinking is, why don't you let them do their work, the work that they do best, which is do the science, and they have to work with the people who are experts in communication. And I'm talking here of behavioral scientists, for example, community leaders. You talk to them and you learn from them as well on how to communicate. We've done this to some extent on a community level, but small experiences, but I think we hope to expand it further. And the other thing I'd like to share is that using people who are credible, who can be heard as the mouthpiece. And if I can use an example, the youth, I think, is a very important sector that we can actually mobilize in terms of our communication. Our experience in the Philippines is when you have the youth talking, they're talking about, you're now talking about climate change and health. What happens to us for the future generations to come? We will be bearing the brunt of all that is happening now. And that has been the voice now, at least in the Philippines. And I think it's working well because, the Philippines is also turning to be a relatively young country. More voters, for example, 40% are actually belong to the 20 to 30-year age group. And so that means that they're really a big force. And I think it's also nice for us to tap this youth. And I think that's something that we still have to work on. Thank you.
Wonderful. Thank you so much, Dr. Montoya. This is great. I'm going to see if I can squeeze in one more question and hopefully hear from you, Friday, and Elliot and Alex as well for this one. So the question to you all is, COP31 will be here before we know it. How do we start thinking about it now while in Belém? If your organization or country is able to achieve one reasonable goal in climate and health to build momentum, what would that goal be so that it's most impactful?
I fully agree with that. Please go ahead, Victor.
No, it's Friday.
Go ahead. Should I go? Thank you very much. I think that's a very important question. And because I know that whatever we've been describing the nature of the problem is part COPs. But I think in COP31, we should be talking about what we have done in our various countries to find solutions in terms of resilience and all of that. And I hear very confidentially, I don't know whether it's true, that Ethiopia will be hosting the next COP31. If that is so, then you are coming to the region of the world where the problem of climate change is most acute. So we'd like to hear a lot of presentations and solutions to the problem of climate change in a region that has the least contribution to the factors that lead to climate change. What can we do in that region? What can we do to assist? Because we're talking about communication. I can tell you that part of the challenge of communication in Africa is the part of illiteracy, that really the people find it difficult to understand what even climate change means. I mean, I'm academics, those of us sitting here, we know what climate change means, but to describe that to low population of women, we don't have for men, I talk about women becoming gynecologists, men and women who don't have adequate literacy on the subject matter, even changing it to their local language will be very daunting because those certain terms as climate change don't exist. So I think that for COP31, we should be looking at solutions, specific solutions for different parts of the world that address the problem, from Africa, from Asia, from Chile, and so on and so forth. And those who have succeeded in building resilience should share those experiences with us so that we can learn how to use them to build our own resilience in terms of climate change. I'm looking forward to that. If it does take place in Ethiopia, I hope to attend. I would like to attend. And I think that between now and then, we should begin to put things together to see what solutions we are using in various countries. Thank you very much.
Thank you, Dr. Ogunefua. Elliot, did you want to finish your talk and then we'll turn over to Alex?
Yes, I just would like to say that I fully agree what Dr. Maria Neira has said, but I think one thing is that we started a little too short before Belém, and of course we will have more time until the COP31, but I think it's extremely important that we keep this talk in the press throughout the year until COP31, because I think we will get a lot of input from the public and keep this subject alive and discussed, because it cannot be just us. It should be, we should have people, more and more people joining us. Thank you.
Thank you. And over to Alex to close this out.
I would actually echo that, and just learning from experiences with the UK hosting COP 3 years ago, or 4 years ago, sorry. And I think not thinking about it just in the short term from one COP to the next, but having that longer term vision of what comes beyond just that sort of annual cycle, and the importance of that and recognizing that.
Great, wonderful way to close out, at least for this session. So I want to again thank all of our presenters. This has been a great look at just a surface level view of the amazing work that is going on across the globe, because as we brought in our earlier meetings about 30 or so academies, we just saw the breadth and depth of what is going on, and wanted to give a snapshot to those of you who are joining us today to see the work that is going on. So again, thank you to our speakers. From here, Dr. Zhao, maybe I can turn it over to you and you can talk a little bit about some proposed next steps.
Yeah, I think that what we all talked about is what do we do next? And focusing on COP31 and beyond, as Alex said. So I would say, number one, that that is you, me, Elliot, and Guto, can create a questionnaire for the members of this coalition to say what are the 3-4 priorities you want to work on going forward, both for COP31 as well as for the long term. And once we have received all the data, we can prioritize those 3 or 4 questions and then started forming working groups to talk about how we can advance some of the ideas forward with actions, with priorities. And that would be the basis perhaps for our next convening of all the academies. That would be my suggestion, a questionnaire where we can ask you to prioritize what are those areas. And today I heard really excellent presentation from Jaime, from Friday, with the 4 different point approaches, from Sandra, from Alex, and from everyone. So I think we can do that. Once we have it collated, we'll see what our priorities are and convene everybody to start forming working groups. That would be my proposal.
Thank you so much. Thank you so much, Victor. Elliot, do you have any final words that you'd like to say in our last 60 seconds or so?
Well, I just want to say that I'm looking forward to be in Belém and to share with you all my impressions on how much we could achieve there. But I hope to continue to work because I think it's an extremely important subject. Actually, it's crucial for the survival of our planet. So this is what I'm looking for. Thank you.
Thank you so much. And Dr. Zhao, any final thoughts to close us out?
Well, first of all, I see Maria still on. So Maria, thank you. We now make you a friend of the academies. As you know, Maria actually is on the steering committee of our Grand Challenge. So she is such a thought leader. We're so glad to have you involved. So if you don't mind, we'll make you a friend. And therefore, we'll consult you in many of the things that we are thinking about. So thank you. And I want to thank Elliot, my partner, Guto. You can see Guto's on now. Guto Galville. Of course, Chris for putting this together. First of all, Elliot, have a great meeting in Belém. But secondly, let's meet very shortly. We put together a questionnaire and then try to plan the next step. Thank you.
Well, I just would like to thank you, Victor, for putting me into this because I'm really enjoying it. Thank you.
Good. Thank you.
Thank you, everyone.
Thank you. All the
Thank
best.
you
very much.
so much. Ciao, Guto.
Bye-bye.
Ciao, Maria. Gusto
Ciao, everyone.
verte.
Lovely to see you. Ciao, Jaime. Hola.
Hola.
Sandra, todos. Thank you.
Thank you.